Welcome back to Taking Charge of My Cancer podcast. And I'm so delighted to have as a guest a very special person, Dr. Anamaria Yeung. Dr. Yeung is a physician and is a Florida native and complete all her education here in Florida. She went to Florida State University for undergrad and received her MD at the University of Florida back in 2004. Then she completed her residency in radiation oncology here at UF in 2009 and stayed at UF and joined faculty in 2009, where she ascended ranks to become a full professor of radiation oncology, specializing in thoracic and gynecological cancers. She holds board certification in both radiation oncology and lifestyle medicine. During her 15-year career in academic radiation oncology, Dr. Yeung loved being able to walk with patients through the journey of a cancer diagnosis and treatment. It was an honor for her to be a part of this difficult time in her patient's life, but after several years of seeing an increased numbers of younger and younger cancer patients, she came to the realization that she wanted to start helping patients to prevent cancer rather than treat cancer when it had already taken a hold. Over time, she discovered a tremendous amount of scientific data, concluding that a large proportion of cancers could be prevented with just lifestyle changes, such as eating a whole food plant-based diet, regular exercise, improving sleep, and reducing chronic stress. Then she started on her path towards a career change to lifestyle medicine. So in 2024, Dr. Yeung, along with 3 other amazing partners, found Empower Lifestyle Medicine. Their mission is to empower people to prevent, treat, and reverse some of the chronic disease that plague so many of us today, including obesity, diabetes, cardiovascular disease, and several types of cancers through lifestyle changes. She is married with 2 children and has been living in Gainesville since 2000. Loves spending time with her family and friends, relaxing and eating together. She's active and her exercise routine consists of weightlifting, rocking with some occasional running sprinkled in. She's an avid supporter of her local farmer market and regular buys way too much fresh vegetables because they look so good, only to throw them out a week later because we can cook so many veggies. So Dr. Yeung, thank you so much for being with us today. I'm so excited about this conversation.
Thank you so much for having me, Darlie. It's really an honor to be here.
Thank you. So you want to tell me a little bit your role and were you always planning to do this, meaning being a radiation oncologist, and then we can talk about this little, like not little, but big change in your career at this point.
So no, I did not always plan on being a radiation oncologist. I decided I wanted to be a doctor a little bit later on in life, towards the end of my undergraduate career. And that had a lot to do with my dad getting diagnosed with cancer, and just going through that process with him. So I knew I wanted to be an oncologist early on. But then I found radiation oncology. It's a very small specialty and not well known. So I found that towards the end of medical school. Really liked it, really liked, the role that radiation plays in cancer treatment and how radiation oncologists, how they get to interact with patients and really follow them and are part of their lives for a long time. And so I decided that's what I wanted to do and then pursued a residency in that.
Great. And then I kind of already on the bio explain a little bit of your shifting. So what triggered that shifting into your career?
Well, I really started feeling like I was seeing more and more really bad cases of cancer, very advanced cancer, and it was happening in younger and younger patients. A lot more towards the end of my 15-year career in oncology, I was really seeing a lot more 30-year-olds and 40-year-olds with cancer. And it was especially in cancer with cancers that are related to lifestyle. So things like endometrial cancer, which is related to obesity in women, and it is traditionally a cancer that's only in postmenopausal women. but in the last 5 years of my career, I was really seeing it a lot more in premenopausal women. So women who haven't even gone through menopause are getting endometrial cancer, which is a postmenopausal cancer. They're getting it before they go through menopause, and it's directly related to obesity and the extra estrogen that adipose tissue produces. Um, and then I was seeing a lot of colon cancer in younger patients. I was not a GI specialist, but I saw a lot of colon cancer patients with metastatic disease or spread of the cancer to other places in the body. Um, and that was happening in younger and younger people, people in their 30s and 40s. Um, and that, the more it started me on this path of trying to figure out what was going on. Um, and the more I learned about it, the more I realized a lot of that is related to what we have been eating in the last 50 years, which is very different than what we were eating,
Mhm.
from the beginning of time until about 50 years ago. And also our lack of physical movement, our sedentary lifestyle that we've adopted as things get more and more um, easier for us to do and more convenient. We are moving our bodies less and less, and so all of that plays into the this what I was seeing, which is younger and younger patients getting cancer.
Got you. So we're moving into my next question about wellness medicine or lifestyle medicine.
Mm.
So what is the difference? So what is it so for the audience out there that goes like, okay, we know traditional medicine, and then we have, this functional medicine, lifestyle medicine, or wellness medicine. What will be the difference?
That's a really good question. I'm glad you asked that. So traditional medicine or I mean, it's all what those things are all Western medicine, but traditional medicine is really sick care. So physicians are taught in medical school and in residency how to take care of people with specific diseases. So as a radiation oncologist, I was trained to take care of people with cancer and fix that problem, to treat their cancer and cure their cancer. An orthopedic surgeon is taught to fix a broken bone.
Mhm.
A urologist is taught to fix, someone who has difficulty urinating.
Mhm.
So it's really focused on the disease and the sickness. Traditional healthcare is not focused on prevention, and it's not focused on the big picture of, looking at the whole body and what we're doing to our bodies and how that relates to health or not being healthy. Lifestyle medicine and functional medicine are similar in that they're both looking at a holistic view of the whole person. Um, Both lifestyle medicine and functional medicine are focused on um, being on health and prevention and getting people healthier rather than just trying to fix a specific sickness or illness or disease. Um, the difference, they're very similar, lifestyle medicine and functional medicine. The difference really, as far as I can tell, is that with lifestyle medicine, we're really working with the 6 pillars of lifestyle medicine, which is nutrition, exercise, improved sleep, reducing chronic stress, reducing toxic substances, and improving personal connection. With functional medicine, their focus is more on doing lab work, doing a lot of labs to try and understand what's going on with somebody from a sort of lab perspective. And then they're also very focused on supplements. Lifestyle medicine, we're focused on getting most of the nutrients that you need through better food by improved nutrition.
Okay, great.
But overall, very similar um, uh, approaches to health.
Got you. So if you're talking about functional medicine, do a lot of more lab work, right? Looking into, vitamins and, all these different toxins that you can have in your body and so forth.
Mhm.
Do you guys from lifestyle medicine do any of that at all when it's necessarily?
Yes, we do. So we, in lifestyle medicine, we still do lab work, like vitamin levels, um, a lot of, looking at things from a metabolic perspective,
Mhm,
like insulin level,
mhm.
just to sort of catch pre-diabetes and work on that. Um, but it's not, I think in functional medicine, there's sort of just a stronger focus on the lab work.
Got you. Okay, great. Um, will you be able to give us three valuable tips for patients who are going through cancer right now? If you have three things or more, I'm sure you have a lot of nice tips. What will be the main things that you feel like, okay, you're going through this, this is things that I will advise you to do to try to improve the outcomes?
Yeah. So I thought about this, and I think the main three things that I think are the most important are exercise. And I know you spend a lot of time focusing on that, Darlie. And for a really good reason. There's so much data that shows that for everyone, for healthy people, exercise is huge in terms of living longer and living better. Um,
Mhm.
there's a lot of really good data for that. And specifically for cancer patients, for people going through cancer treatment and have active cancer, staying active and doing exercise during your treatment really helps with reducing fatigue, the fatigue that is related to just having cancer and the fatigue that comes with cancer treatment, and really keeps the body as healthy as it can be going through the difficult treatment. So that's number one. Number two is nutrition. So we tend to tell patients what we don't want, and this is what I always told patients: we don't want you to lose weight while you're getting cancer treatment. And I still think that is very true. But I used to tell patients, so eat whatever you want, just don't lose weight. If you want to have ice cream all day, every day, then do that so that you're getting enough calories so you're not losing weight. Which, not losing weight is incredibly important because if you start losing weight, your body isn't getting enough nutrition or nutrients to sustain itself while going through a really difficult treatment. However, now I add to that, try and eat whole foods with an emphasis on fruits and vegetables during your cancer treatment. Um, because what you want to do is provide your body with all the antioxidants, all the vitamins, in addition to the protein and carbs and fats that it needs. So focus on trying to eat whole foods and especially fruits and vegetables. Now, it can get really hard to eat while you're going through cancer treatment. So if it comes down to all you can eat is a boost shake, then you do that. But if you can, then try and do whole foods with fruits and vegetables.
Will you,
And then
I'm
mhm,
sorry, will you emphasize more on the fruit and vegetables versus protein? What are your thoughts on that?
I think the protein is very important. It helps to not lose as much muscle mass while going through the treatment. Um, but I think a lot of people are already focused on that and they're not so much focused on fruits and vegetables. And so that's why I'm sort of emphasizing the fruits and vegetables. But you're absolutely right. The protein is very important.
Okay.
And then the third thing is having a positive mindset, which people don't talk about that much. And in traditional medicine, we really don't talk about that at all. Although every oncologist will tell you that their experience is that patients that have a positive outlook from the get go tend to do better than their patients that are super anxious and worried and think it's all going to be terrible. Um, and now I know that there's actually data to support that, that having positive thoughts and positive social connections and a supportive network around you, and just focusing, like truly just focusing on the positive in the situation, um, has an actual uh, good effect on your health and how you're going to do through your treatment.
That's very good value. And again, sometimes you're right, right? One thing that I know we lacking, and you know this already, is that mental health component of it, right? So
Yeah.
it's like how many times we see patients here who is hard, right? You just get diagnosed with cancer, your life just falls apart, right? You're thinking
Yeah.
your significant other, the kids, whatever is around by you, and you're thinking, I'm just gonna die.
Mm-hmm.
And then we throw a tons of information about surgery, medical oncology, radiation oncology, all these effects that can happen, but really, like, how are you feeling with all this information inside your head? So, and then you want them to go to counseling, but then, like, how do I do that, right? So it's like, well, let's just try to get a hold of somebody, and then it's like wait list to kind of get to them, and so it's really hard. And it's not like looking for meds; it's just really looking to talk.
Yeah,
Yeah, so that's for sure super hard to try to find out there.
it really is. Yeah.
Yes. So, how about any painful lesson that you learn along the way?
Well, for me, I was thinking about this too. Um, this is a lesson that I learned for me, not necessarily for my patients. And really, it's the lesson is as a professional in a medical career, um, it it's I learned fairly recently that it's okay to change. It's okay to change course. It's okay to do something different, that I'm not defined by my career. And then I can reshape what my career looks like. And it doesn't have to look like what everyone thinks it should look like. It can be totally different, and that's okay. And that's a good thing. Um, and especially as a woman in midlife, it's okay to reinvent yourself in midlife. And it's not, I had gotten to this point where I was starting to think of my career as like I was at the end of my career, in the twilight of my career, and like it was just going to be what it was until I decided to not work anymore. And it's been really refreshing to sort of like just view myself and my career in a totally different way and give myself the opportunity to make a big change. And at my age, I'm almost 50, at my age, to be able to do something totally new. um it's okay to do that, and it's a good thing.
Yeah, that's super excited. Not that
Hmm.
many people is able to do that. Like you say, you
Right.
thinking you have everything planned out, like, oh, I'm just gonna settle here and figure out what I'm gonna do, retirement, whatever. And
Right.
now it's like completely flip. But you're right. I think that just kind of really doing something new. Let's
Hmm.
just keep you up, keep you refreshed, keep you, like I say, when I saw you, and I have not seen you in a little while, it's like you look so refreshed,
Hmm.
which is great. It's a new motivation, and I'm sure it's gonna be. I know you just started this new journey not long ago, but I'm sure you're gonna start to see the outcome side of it. Like how I can really see this, and how can I start helping people
Yeah.
reversing things before get to that point of cancer, right?
Right. Exactly.
Yeah. Would you ever thought about you still being involved with some of the radiation oncology, right? So you still,
Yeah. Hmm.
yeah.
I'm still doing the brachytherapy procedures at UF.
Yeah, exactly. So I was gonna say, you still are you as in yourself when you see these patients? I'm sure that right now is like a mix, right? You're not going with your same traditional medicine head any longer. Now it's just really bringing the patient in a completely different, which is, I think this is what that will be ideal to see. I love to see traditional medicine mixed with lifestyle medicine or functional medicine, and that collaboration I think is not one versus the other. I think is such a very huge value for both of them coming together.
Yeah, because people need sick care.
Yeah,
Someone who has cancer needs an oncologist to treat the cancer.
yeah.
You can't do away with that. If you break a bone, you need an orthopedic surgeon to fix your bone.
Mhm.
But people need more than that, and I think people are looking to not just not just treat whatever diseases come up, but try and prevent those diseases from happening in the future and actually be healthier than they are right now. And I agree, it should be combined. There shouldn't even be a differentiation. But our healthcare system, the way it is now, there isn't time. Physicians in traditional medicine don't have the time to spend working on lifestyle things and prevention with patients because they have to see so many patients because of insurance reimbursement. So it's an entire issue with our healthcare system that I don't see a great solution for anytime soon. But that's really the issue. Lifestyle medicine should be primary care physicians should be doing lifestyle medicine, but
Yep.
there's no way they can do that. They just can't.
Mhm. Yeah. Well, we know where to find you now. So start driving patients your way. So what good resources would you advise for patients to educate themselves when they're going through a cancer diagnosis?
So there's two websites that I really like that are specific. Sorry, one that's specific for cancer, and it's called the American Institute for Cancer Research, and the website is aicr.org. It is really good. It's very specific for cancer, and it addresses a lot of the lifestyle medicine pillars. It addresses nutrition and exercise and sleep and stress. And it's in a very patient-friendly way. So I think that's an excellent resource. Um, Another one is American College of Lifestyle Medicine, and that's lifestylemedicine.org. That is targeted to practitioners and patients. And so for patients, they have to sort of find the patient part. But once you get there, you can find a lot of really good resources. And then the third one is specifically nutrition, but it's a very helpful website. It's Forks Over Knives. It's got a ton of information. It's got a lot of really good recipes that are free. You don't have to pay for any of them. It's a really good resource for someone who wants to start looking at a whole food plant-based diet.
Right, that's awesome. And I'll make sure to put those on the show notes so people have access to those.
Okay.
Um, how can people find you?
At our website, which is www.empowerlifestylemedicine.com.
Great. And do you guys do telehealth?
We do. Our goal is to see people for their initial visit in person, um, and then follow-ups are telehealth, but we can also make it so that the initial visit is telehealth if that's more convenient.
Okay, great. Um, how about what is means to advocate for yourself and how can people do that?
What is what for yourself?
Advocate for yourself.
Oh, advocate for yourself. Yeah. Um, so I feel like like I said, in traditional medicine, physicians are overworked and don't have time. And it's really easy to get into the space as a physician in traditional medicine to sort of, you know, not do a good job hearing your patients. And so I think it means advocating yourself is just make sure that you're actually heard. Um, the physician or practitioner might not, they might be rushing because they have to see a bunch of patients or something happened or, for whatever reason, and they're just not focused on you at that time, even though it's your time to see them. Um, and so I think patients need to just make sure that if they say something, if what their issue is, if they feel like they expressed it and it wasn't really heard, then they just need to keep repeating it until they get from their physician that they were heard and that the issue was addressed. Um, and it's not rude to a lot of patients think they're being rude or they don't want to, upset the physician. That's not the case. Physicians are just humans and we're trying to get a task done. And sometimes we need to be told, like, hey, no, 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 this is the issue. You didn't hear me, but I need you to hear me right now. Um, Sometimes that's going to mean that you have to go outside of traditional medicine to really advocate for yourself and to get yourself heard. Um, and then the other thing I feel like is, a lot of people are doing a lot of research online about, what's going on to try and figure out what's going on with them, which I think is great. I think, the more information that patients get, the better. Um, but there's a lot of misinformation out there. And I worry that in people's efforts to advocate for themselves, they do research and then they're relying on,
Misinformation.
sources that are not accurate.
Mhm.
And then they're getting themselves down this rabbit hole that's not a helpful place to be. So one way to cut through all that misinformation is to always ask for the evidence, always seek evidence-based medicine. If it's a legitimate treatment, then there should be research studies in peer-reviewed journals that support that treatment. And so people just keep that in mind, then I think that'll help steer them in the right direction.
That's very good. So you mentioned early on about nutrition, and I know nutrition is huge for you. I have heard you in Cancer Connections with an amazing presentation on nutrition, and I know we can talk about nutrition for hours, but why you think is such a key role to prevent some cancer occurrence or reoccurrence at some point?
Yeah. Well, so if you think about it, we are putting chemicals into our bloodstream 3 to 5 times a day, every single day, via our mouths through eating. Like, there's nothing that we do that's as often as eating. And what we eat is being broken down into chemicals inside our body and then getting distributed throughout our bodies through our bloodstream. And so if we are not making good food choices, then we're putting not good chemicals into our bloodstream 3 to 5 times a day. Um, and that has a huge impact on our health overall, and that includes the likelihood of developing cancer. So, for example, if we eat foods that have a very high antioxidant content, like a lot of fruits and a lot of vegetables, then we're helping our cells stay healthy by fighting free radical damage. On the other hand, if we're eating a lot of processed meats, we're introducing a lot of chemicals like N-nitroso compounds and heterocyclic or aromatic amines that actually work to damage our DNA in our normal cells, and then that can lead to cancer. So um, it's the frequency. People get, I think, a lot very sort of focused on chemicals in the environment and things like that, but we are actively ingesting chemicals multiple times a day have a direct effect on the cells in our body. And that's why I think food and nutrition has such a huge impact.
Great. You were mentioned about like some of the supplements, right? So you hear like, if you have issues with your thyroid, then let's go ahead and try to do iodine or try to do these other things as well that, I've been hearing lately, like through podcasts, a lot of some of the functional medicine and really great stories. But so sometimes it's overwhelming, right? Like, okay, I have this vitamin down, like I have these supplements, like so many out there. Like, what is your advice with that? Like, it's like, should we go by, yeah, this is what your blood work is showing in regarding vitamins, and then you should be just do the minimum. Sometimes it's overwhelming, like, at the
I
end of the
totally
day,
agree.
it's like, so you're asking me to take 20 things every
Yeah.
day for myself to try to stay as young as possible in a healthy way, right? I don't want to be 15, but certainly I want to try to have a nice to try to be as in like in good health
Yeah.
as long as I can live. So
Mhm.
what is your opinion on that?
Yeah. I think um supplements are so like it's like so appealing because if you could just take a pill to make yourself healthier, it's so much easier than like trying to eat healthy and trying to exercise. So I think there's something so appealing about supplements for all of us. Like even I'm like, what supplements can I take to like make everything better in my body? Um, so it boils down to the best way that we can get anything is in its whole natural state. And so the best way to get your B vitamins or vitamin C or vitamin A is through its whole natural state. So that's always going to be the best way to do it. So I would say number one, eat a whole food diet, plant forward, because most of the vitamins and nutrients and minerals are in plants. Um, it starts there. But then, second, I think it does make sense to get the vitamin levels tested, um, and then supplement as needed to make sure that you're at the right levels. There are certain supplements that pretty much everyone should be taking. Vitamin D, almost all of us are deficient in vitamin D because you can really only get it through the sun. And none of us, we all spend our days inside. When we go outside, we put sunscreen on. So almost all of us are vitamin D deficient. Vitamin B12, especially as we age, as we get to 40s and 50s, we're almost all, even if you're a meat eater, you're going to be deficient in vitamin B12. So almost everyone has to supplement that. Um, the other big one is creatine. Not everyone thinks about that, but there's been a ton of studies on creatine. It's super safe. It helps keep muscle, it helps build muscle. I think it's especially important in women as they approach midlife and beyond. And it's incredibly safe. And then beyond that, I think there is a role for certain other supplements, but I think that rather than get so focused on what all these little supplements can do for you, the bigger bang for your buck is going to be in changing your diet so that you're getting most of those nutrients and vitamins through the whole food that they're packaged in.
Got you, got you. It's another one that sometimes people talks a lot, which actually I do take, is magnesium.
Oh
As
yeah, that's another one. I forgot about that one. I
okay,
also take magnesium, and I agree that's a good one that most
okay,
everyone should take.
okay. And then I have another question for you. So it has been a lot of controversy, and I know a lot of your specialty was gynecology
Hmm.
in this, hormone replacement and estrogen blockers. And as going through midlife, we realize how important is estrogen in our bodies. So again, a lot of things now coming into, should we be really using hormone replacement? And again, even if you have breast cancer, depending on the breast cancer, really it's okay to use estrogen, vaginal estrogen, those kind of things. There's a lot of things coming out on those lines. And guess what we see every day here, right? With patients with breast cancer is
Hmm.
estrogen blockers, right? And
Hmm.
then I hear the complaints, right? For joint pain,
Yeah.
brain fog, miserable, terrible quality of life. And it's like, I just feel like, oh my God, what do I tell the patient? What can I do to help them to find resources to try to make them feel better? So what are
Mhm.
your thoughts on that?
Excellent question. I am a huge believer in vaginal estrogen. Um, I use it on all of my GYN patients except for the endometrial cancer patients because those are estrogen driven cancers most of the time, and I get nervous about promoting a recurrence of their cancer. So I don't use it in endometrial cancer patients. But I would use it in every other patient. And you can actually even use it in patients who have had a history of breast cancer, because when you do vaginal estrogen, it is not absorbed systemically. So it's not getting into your bloodstream, it's not increasing your blood levels of estrogen. It's really just acting locally, and it's excellent for it's called genitourinary syndrome of menopause, which is vaginal dryness, irritable bladder symptoms, like feeling like you have a UTI, burning when you pee, feeling like you have to pee all the time, having like a crampy bladder feeling, um, just discomfort in the vaginal area and the urethral meatus area. It's so good for that. And I personally, you know, think every woman should use it. I think it's excellent. And in other countries, it's actually over the counter and you don't need a prescription for it. Systemic estrogen, I think, well, it's been a controversy and it's been sort of poo-pooed for a really long time, all because of one study
Mhm.
um, that came out, I think it was like 20 years ago, which showed that women who were on estrogen replacement therapy had increase in cardiovascular events and increase in breast cancer. And since then, sort of for years, nobody talked about it, nobody looked at it. Everyone just said no hormone replacement therapy for women. If you have menopausal symptoms, just deal with it.
Mhm.
And in the past, I think like 5 years or so, there's been this resurgence of, well, hey, wait a second, why can't, let's look at that again. Why can't we, you know, revisit that issue? And people have, and now it's very clear that that study, they took women that were more than 10 years out from menopause. They were mostly in their 60s and higher. And the estrogen that they used was, it's an estrogen that we don't use it anymore. It was like the equine estrogen.
Mhm.
Um, and so looking now at women who are within 10 years of menopause, so they're not years and years out from menopause, they're closer to menopause, they're actually symptomatic from menopause, and using the newer forms of estrogen, there we don't have those issues. We don't have we're not seeing that increased rate of cardiovascular disease or increased rate of breast cancer. Um, so there's still a little bit of risk involved, but it's much lower than what people thought before. Um, and it's really a very good option for a lot of women that are going through menopause and are having menopause symptoms. And let me change what I said going through menopause because that can be confusing. There's this whole period called perimenopause, which is like 10 years long, starts in your early 40s usually, and ends in sometimes in your mid 50s. Um, and that's when women have symptoms. So it's not like they have symptoms for a year and then it's over. This is a huge amount of time that
Mhm.
women are struggling with all of the things you were talking about, brain fog and joint pain and hot flashes. It's a struggle. So um, it's frustrating that for so many years women weren't given the opportunity to have any relief from that. But I'm glad that now we're coming back to, knowing that it's safe, definitely safer than we thought before, and that it's a really good option for a lot of women.
Would you recommend like systemic and like hormone replacement as well, but it's vaginal estrogen, or not necessarily? If you're systemic, you
You
don't
can
have
do
to.
both.
Okay, you can.
So, yeah, so you can, a lot of women, if they're started on systemic estrogen therapy, then that will take care of their vaginal or urinary symptoms. But sometimes they still need the vaginal estrogen cream. So you can do both, and it's totally fine.
Okay, great. Awesome. Thank you. Is
Yeah.
any one question that you wish I'll have you ask you and you'll have answered to wrap up?
Shirley, you even asked me extra questions, so I cannot think of any other questions for you to ask
No,
me.
that was so great. Again, I can pick your brain just because I know you so well, and you always been like, I'm sure like everybody's missing you here
Oh,
from the radiation oncology standpoint. But I am so excited to really work with you and collaborate with you and actually give patients your information so they really can start looking into. I'm all about that. I'm all about we gotta be looking at the whole picture, not just one thing. And let's try to see we can help them somehow, going through all this. Because what I get a lot is we do this, breast surveillance program where I see them 5 years, all the way down after they've been going through cancer or even longer. And now they're like, what I hear a lot from women is like, or even other patients is like, so now what, right? I'm done with radiation, I'm done with chemo, I'm done with endocrine therapy, or I'm in endocrine therapy, and now who I'm still having all these symptoms. I'm still really not myself. I'm still struggle every day. And what should I do about it? If I contact medical oncology, they just tell me, well, you just pretty much try to deal with it because it's nothing, it's part of the whole thing. And I don't think that's enough as a good answer. Sometimes I put myself in their shoes, like, I don't know if I want to hear that answer. I want to know what else can I do out there that can help me to improve what I have, or at least try to get me into, let me just not have the fear that this is maybe it's going to happen again, or every time I'm going to have a mammogram, something is going to show, or every time I'm going to go to a CT for follow-up post-radiation, man, something else is going to show on my CT scan. So I think it's super important. I'm so glad that you're doing this work. I think is really is lacking, and I'm sure that hopefully more and more of our, traditional medicine docs start to really looking at that too. Yes, I may don't have the time right now to talk to you, but I want you to see somebody who can, and then
Right.
we send it to you, or because I don't even know if it's any options for us here. I mean, we have here integrative medicine who does some of it, but how much
Yeah.
is really getting involved, or you have to have a referral from the doctor, your insurance doesn't cover, or it's all this game with insurance. It's unbelievable. So
Nice.
yes. So thank you again, Ana Maria. Really appreciate it.
Thank you, Darlie. Thanks for having me. It's been great.
Absolutely. You have a great rest of your afternoon.